The clavicle, also known as the collarbone, is commonly fractured in people of all ages. Historically, most clavicle fractures were treated without surgery, but more recent studies have shown that this type of non-operative management can lead to long-term dysfunction, and in adults, the bone has a higher likelihood of not healing. I like to think of the clavicle as one leg of a tripod. If that leg is foreshortened, everything tends to lean. If the clavicle heals in a shortened position, your entire shoulder girdle will actually rotate inward, which is how this dysfunction occurs. I see operative intervention as having several benefits: reestablishing anatomic alignment to restore normal shoulder function, maximizing the chance of bone healing, and stabilizing the bone so that there is no painful clunking or clicking of the fracture ends. Generally, there are two ways to surgically fix a clavicle bone. The first is with a plate and screw construct that overlies the bone and stabilizes it. This is a great option to restore stability and anatomic alignment, particularly when the fracture is significantly comminuted or in multiple pieces. Second option, as in Ali's case, is fixing the bone with a clavicle nail. This is a metal rod that is essentially hidden within the tubular structure of the bone and cannot be felt under the skin after surgery. This minimizes the chance of irritation from the straps of a backpack or a handbag. This surgical technique also minimizes the size of the incisions, which are about 2.5 centimeters in length and fall in line with the clavicle. Once they're healed, they are barely noticeable. I like patients to limit their range of motion for the first 4 weeks to minimize the chance for displacement. Motion typically returns quickly and physical therapy is not usually necessary. Clavicle nails are really a great option for patients who have displaced clavicle fractures but want a nice cosmetic result and an early return to normal function.